Autumn Woods Nurses. It's Tasha, and today we're going to talk a little bit about sharps. And we're going to talk about needle stick prevention, and we're going to talk about what we should do to prevent needle sticks and what we will do if we are actually stuck by a needle. So first thing I want to talk about is some statistics. So according to the CDC, 385,000 sharp sticks a year or sharps injury a year occur in healthcare fields. And then 48% of those occur while healthcare workers are actually using an item. The number one item that causes sharps injuries in healthcare is disposable needles. And more alarming than that, most of those occur with us, with nurses. So, and they say that these injuries occur for a few reasons. One, we're not using the products correctly. Two, we're recapping needles. Three, we're transferring body fluids from one container to the other, which sometimes we have to do, especially with our new lab, with Quest. Some of those are asking us to spin down, and then some of are asking us to take a portion and put it into another container. And right there, needle sticks can happen. And fourth, the failure to dispose sharps in a proper puncture-resistant container. So that's the reason why they say that us nurses have so many sharps injuries. Now I want to share my story with you a little bit. On my very first job as a nurse, I worked at Sinai Grace in the emergency room. And back then, during that emergency room, it was very high turnover. And so often when nurses were starting IVs, they would start the IV, and as they would insert that catheter, they would pull the needle out and stick it in the bed. And then after they secure the IV, then they would put that needle in the sharps container. But because the turnover was so high, I was going to remove the sheets from one bed to get it set up for a new person. And as I went to grab those sheets, I was stuck with a needle. And when I looked down, the person who had just left out of that bed did not have an IV started. And so I didn't know where that needle stick came from. So, and at the time, I was 5.5 months pregnant with twins. And so it was a very, very, very scary time because somebody was not careful enough to put the needles in a sharps container immediately after use like we're supposed to. And so I had to make that difficult decision during that time whether or not I was going to terminate that pregnancy, and because there was a medication that you could take to prevent HIV from crossing over into your system, and so but I would have to terminate the pregnancy in order to take it. So I have twins, so I did not take it, and fortunately for me, I did not contract any diseases because of it. But we're absolutely 100% exposed to bloodborne pathogens through blood and body fluids when we work in this field. And it caused me to have to be tested for HIV every 6 months for 5 years. And thankfully I never did contract it, but I could have. So the next thing I want to talk about is prevention. How can we prevent needle stick injuries? There's a few things that we can do. We can use the devices with safety features. So many of the products that we use here, many of the disposable needles that we use here, they have safety features in order to keep us safe. So I'll show you a few of them. So this is our TB syringe. So when we use that TB syringe, after we're done using it, there's a safety feature for us to pull it up and turn it. Now it's locked, and it cannot come down, okay? Another one of the safety features we have is on our butterfly needle. So when you get ready to do the butterfly needle, of course, we take that off, we insert it so we can draw blood from the patient, and after we're done, there's a flap right here to put over that needle. And that will keep us from sticking ourselves. Another safety feature, another needle that you'll see every single day that you work is the insulin syringe. So after we draw up the insulin and we give the insulin to the patient, this is another one that we just pull up and turn. And then that is locked to keep us safe from a needle stick injury. Here's an angiocath. So when we are started an IV, like when I got stuck, now there is a safety engineering on this needle. So once we advance that catheter and we pull the needle out, as you can see, there is a mechanism right on the tip of that needle to prevent us from getting stuck. We also, you'll see this needle sometimes on the units when you have to do an IM injection. You'll see this needle, and this one, after you finish sticking the patient, it has this nice orange safety mechanism that you can just close like that, but you won't use your hand. You'll use a hard area, a desk, or a sink or something like that. Then this is another needle you'll see on your units that you can use for giving IM injections as well. And the safety feature it has, you just pull that all the way up when you're done and turn it, and it will lock and it cannot come back down, so that you won't be stuck. We have a couple of needles that you may see. So this is a 3 milliliter syringe from Medline, and this is also a 3 milliliter syringe. Both of these syringes do not have safety devices on them. So when you are using these syringes, you need to, after you finish giving the injection, you need to immediately put it in a sharps container. Never ever recap this needle. Even I see some nurses will set the cap down on the table and recap it like that. Don't do that. We don't recap ever. So what we have to do is dispose all sharps in a puncture resistant container, and it will be labeled that it's for sharps, okay? And so immediately after using any of these devices, even those that do have safety mechanisms, we put it in a sharp container, okay? Anything sharp goes in a sharp container, including broken glass. And we're not gonna put our hands in there. The other thing I want to show you about this sharps container is there's a line on here. So when it's 3/4 full, or when it reached that line, then we get rid of the sharps container. And where do we put it? We put it in the soil utility room in the biohazard waste bins, okay? That's where we get rid of them. All right, other ways we can prevent, we already talked about using the safety devices, avoid recapping needles like we just talked about, promptly dispose of sharps in appropriate container like we just talked about. The other three things: one, tell your employer about any hazards or needle stick hazards that you may see while you are working, so that we can do something about them. You don't have to ever work in unsafe conditions. So if you see something that maybe the employer has not seen, please report that promptly so that we can begin to do something about that. Number 5, plan on safe handling of needles prior to usage. And what that means is know what kind of product you have, know what the safe handling of that needle is, have your sharps container right nearby. Because in our building, we don't have sharps containers in every room. We have sharps container on the nurse's cart. And so if you are going to give an injection, have that cart right outside the door so that you can promptly dispose of that needle. And number 6, participate in all training by infection prevention. And that's what this is about. So this training is going to help you, I hope, prevent you from having a needle stick. But if you do, so I got stuck with a needle, what do I need to do? Number 1, I need to wash that area immediately with soap and water. You need to get that area clean, hopefully preventing any bacteria or viruses from getting into the skin. Number 2, you need to report that incident to your supervisor, and not at the end of your shift, not after you get done with the next couple of patients, not after the med pass. It needs to be reported immediately. It needs to be reported immediately. Number 3, you need to fill out an incident report. If you are stuck by any sharp object, whether it's a needle, a piece of glass, anything, that you need to fill out an incident report. And 4, super important, seek medical attention. We need you to be able to go to Concentra and find out if you're okay. We need to make sure you're okay. You may have to go through a series of tests like I did. Mine I had to go through for 5 years, getting tested every 6 months. So I hope that all of this will help you to prevent you from ever being stuck with a needle. But if you are, you'll know exactly what you need to do. Thank you so much for all of your service, and continue to be safe nurses here at Autumn Woods. Thank you.